everyone, my name is Kalem, and today I'm going to be presenting to you all some normal medical suffixes that you might expect to see if hopefully one day you end up working in the medical profession. So without further ado, I'm going to start the presentation. So the first medical suffix I'm going to be talking about today is the medical suffix plegic, or also plegia. So this medical suffix denotes paralysis. So whenever you see plegic or plegia at the end of a medical term, we're talking about some form of paralysis. So in the example I have here, I have hemiplegia. So the hemi prefix, of course, means half, in this case, half of the body. And of course, you have your plegia suffix. So this medical term indicates paralysis of one side of the body. And some other examples include quadriplegia, which I'm sure you've all heard of before, which involves total paralysis of the body, as well as monoplegia, which involves paralysis of a single part of the body or a single limb. Now I have a quick video I'm going to show you all. It's going to be describing a procedure known as an appendectomy. And at the end of this video, I'm going to discuss with you what the suffix ectomy means. And hopefully after watching this video, you all have a pretty good idea of what it means. So let me start that video.
Removal of the appendix, called appendectomy, is performed when appendicitis is suspected. Right lower abdominal pain, fever, and elevated white blood cell count are common symptoms and signs of appendicitis, which usually occurs when a blockage develops between the appendix and the intestine. This leads to infection, swelling, and distension. If the appendix is not removed, it can lead to a life-threatening perforation or rupture. The only treatment for appendicitis is appendectomy, which is almost always performed on an emergency basis. Newer laparoscopic techniques require only tiny keyhole incisions or puncture wounds, which generally result in a shorter recovery period. Before your surgery, an intravenous line will be started. Appendectomies are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be temporarily inserted through your mouth and into your throat to help you breathe during the operation. A catheter may also be placed in your bladder to drain your urine. An uncomplicated laparoscopic appendectomy usually takes between 20 and 30 minutes. To gain access to your appendix, your surgeon will use sharp instruments called trocars to create 3 small holes or ports through your abdominal wall. These ports are usually located at your navel or umbilicus and in the upper right and lower left quadrants of your abdomen. Carbon dioxide gas will then be pumped through the umbilical port to puff up your abdomen so its contents can be viewed more easily. Next, your surgeon will insert the laparoscope through the umbilical port. Images from its camera are projected onto a video monitor in the operating room. Your surgeon will carefully examine the inside of your abdomen, confirming that your appendix is red, swollen, and needs removal. At this point, your surgeon will pass surgical instruments through the other 2 ports, grasp the appendix, separate it from the intestine, drop it into a specimen bag, and remove the specimen bag through one of the ports. After your appendix has been safely removed, your surgeon will instill warm, sterile salt water through one of the ports into the abdomen to cleanse the abdominal cavity and remove any traces of infection. The salt water is then suctioned out. Before removing the laparoscope, your surgeon will take one final look around for areas of bleeding or other damage. When the laparoscope is removed, a port valve is left in place briefly to allow all the carbon dioxide to escape from the abdomen. Finally, the keyhole incisions are closed with sutures or staples and covered with bandages. At the conclusion of the surgery, your breathing tube and catheter will be removed, and you will be taken to the recovery area for monitoring, where you will be given pain medication as needed. When you are able to drink liquids, your intravenous line will be removed. Most patients can leave the hospital within 24 hours.
Okay, so that's the end of that. Okay, so as I'm sure many of you put together after watching that video, The suffix ectomy means to remove or to cut something. So in this case, since we're talking about the appendix, in the term appendectomy, the append part refers to your appendix, of course, and then the ectomy to the removal of the appendix. So appendectomy is the procedure of the surgery involving the removal of the appendix. Next suffix. So next suffix is emia. So emia indicates that the condition we're discussing involves the blood. So it's a condition of the blood itself. So in this example I have up here, I have hyperglycemia. So the hyper part refers to an elevated level, in this case glyce, which means sugar. So elevated sugar, and then the emia part in the blood. So hyperglycemia would be an elevated level of sugar in your blood. And this is a condition that's very common, for example, in people with diabetes, in which their diabetes is untreated. And of course, that will result in sugar building up in their blood supply as their cells cannot properly absorb that sugar. The next suffix I will discuss is lysis. So lysis can mean these three things up here. So it can mean disruption, destruction, or the release of something. So in this example, I have hemolysis. The heme part refers to red blood cells, and in this case, lysis is referring to destruction. So hemolysis is when red blood cells are being destroyed. So one potential disease in which hemolysis would occur would be an autoimmune hemolytic anemia, which is a condition in which your own immune system will target your red blood cells with antibodies, resulting in their destruction. So the key word for this presentation that I'm doing today is lemon. So keep that in mind, write it down somewhere. You'll need it for the end of Camp Med, along with your other keywords. So now I'll present the suffix itis. So itis, as I'm sure many of you have already heard before, is inflammation. So in this example, I have arthritis. So the arth part refers to the joints, and then of course itis, inflammation. So arthritis is a condition in which your joints are inflamed. So one potential diagnosis of disease would be rheumatoid arthritis, in which one of the defining characteristics of this disease is, of course, the inflammation of the synovial membrane in your joints. So now I have another video. This one is on fibromyalgia, and much like the previous video I presented, hopefully this video will kind of give you an idea of what the suffix algia indicates. And of course, at the end of the video, I will give you the answer what algia means. So let's start this video.
Today's topic is fibromyalgia. Fibromyalgia is a medical condition characterized by a widespread pain in the muscles and bones, accompanied by fatigue, sleep, memory, and mood issues. Most people who suffer from fibromyalgia are women. However, men and children also can be affected by the disorder. Fibromyalgia is a chronic long-term disorder and is due to the abnormalities in how the central nervous system processes pain signals. People with fibromyalgia have a heightened sense of pain, sometimes described as muscle ache. The condition isn't a progressive disorder, meaning it won't steadily worsen over time. Many people who suffer from fibromyalgia also have irritable bowel syndrome, anxiety, tension, headache, and depression. The pain and sleeplessness associated with the disorder can interfere with the ability of the sufferer to function at home or on their job. According to the National Fibromyalgia Association, the disorder affects about 3 to 6% of the world's population. Causes. The exact cause of fibromyalgia is unknown. Researchers are close to understanding factors that may work together to cause it. Researchers believe that the condition is related to an abnormal increase in levels of certain chemicals in the brain that signal pain. This changes the way in which the central nervous system processes pain messages transmitted around the body. In many cases, the condition is triggered by a variety of factors working together. These may include an infection, genetics, physical or emotional trauma, such as a repetitive injury to the body, caused by performing the same action over and over again, the death of a loved one, breakdown of a relationship, car accident. A person suffering from osteoarthritis or rheumatoid arthritis or lupus may be more likely to develop fibromyalgia. Symptoms: an increased sensitivity to pain, fatigue, widespread pain occurring on both sides of the body and above and below the waist, difficulty sleeping, headaches, muscle stiffness, problems with memory and concentration, commonly referred to as fibrofog, irritable bowel syndrome, restless leg syndrome, tingling and numbness in the feet and hands, sensitivity to cold or heat, sensitivity to noise or lights. Diagnosis and treatment. There is no single test that can fully diagnose fibromyalgia. A diagnosis can be made if a person has experienced widespread pain for 3 months or longer, with no identifiable underlying medical condition related to the pain. Other conditions with similar symptoms may be ruled out by blood tests. Blood tests may include complete blood count, rheumatoid function, thyroid function tests, erythrocyte sedimentation rate. Treatment. Although there is presently no cure for the disorder, treatment options are available to help relieve symptoms and make the condition easier to live with. Medications can help relieve pain and improve sleep, such as antidepressants like duloxetine or Cymbalta, and milnacipran or Savella. Over-the-counter pain relievers, such as acetaminophen, as in Tylenol, ibuprofen, as in Advil, anti-seizure drugs, such as pregabalin or Lyrica. Variety of therapies can reduce symptoms associated with the disorder, such as physical therapy, that may include exercises to improve strength, flexibility, and stamina. These therapies have been linked to a reduction in pain, tenderness, and sleep disturbances in patients. Mind-body therapy that focuses on interactions among the brain, mind, body, and behavior. These may include yoga, tai chi, mindfulness, or cognitive behavioral therapy. Thank you for watching our video. Please.
Okay. So as you all probably noticed, term pain came up a lot. So unsurprisingly, the suffix algia refers to pain. So in the example here, myalgia, the my part refers to the muscle, and algia to pain. So myalgia is muscle pain. And just something as simple as muscle pain, depending on some characteristics, such as if it's localized or diffuse, is there stiffness, is there weakness, just that alone can help diagnose a whole bunch of different disorders and diseases, which just goes to show you how even the most mundane symptoms such as muscle pain can help diagnose many very serious medical conditions. So next I have oma. So whenever you see the suffix oma, that means it's a tumor. So in this example, I have a heptoma, I think that's how you say it, in which, of course, the hep part the hepa part refers to the liver, and then the oma to the tumor. So a heptoma is a tumor of the liver. And tumors of the liver are commonly associated, of course, with liver cancer, which can be caused by things such as hepatitis, which is why we get our hepatitis B vaccines, or as well as alcoholism, which can lead to cirrhosis of the liver, which is a condition in which the liver has scarring and excessive fatty buildup. And the last term I will be presenting today is this one here, which is kind of hard to pronounce when it's on its own. I'm going to pronounce it as Raj. It's going to be easier when I say it in an actual medical term. And essentially what this suffix means is excessive or abnormal flow. So the example I have here is something I'm sure you've all heard of before. It's hemorrhage, in which the hem part refers to, of course, blood, and then the Raj, the hemorrhage part, refers to excessive. So hemorrhage is an excessive blood flow. So I'm going to discuss a condition which you might see hemorrhage. So as we all know, in strokes, there's actually 2 types of strokes, or roughly 2 types of strokes you can expect to see. There's ischemic strokes in which a blood vessel is blocked off, either by a blood clot that originates in the brain or one from a different part of the body. But there's also a type of stroke in which there's hemorrhaging in the brain, which leads to the stroke. Now, this is important to know because when providing first aid to a stroke or someone we suspect of having a stroke, we never give them aspirin. Now, why do we do that? Well, typically if someone's having a heart attack, we might give them aspirin because it'll help to thin the blood, which should of course improve the conditions of someone who's suffering from a heart attack. However, when it comes to a stroke, we don't know what kind of stroke they're suffering from just based on the symptoms that they're presenting. And of course, if they're having the hemorrhaging type of stroke, giving them aspirin would actually be a really bad thing because that would increase the amount of blood that's released into the brain. So that's why we never give aspirin to anyone who we suspect of suffering a stroke. So that's something to take away from this. And that, I believe, is the end of my presentation. So I hope you all learned some new medical suffixes today and that you'll be able to apply this knowledge to your upcoming quiz. And thank you all for listening.
Working in medicine in Canada means being able to accommodate and care for patients in both official languages. Sometimes translating word for word from French to English or vice versa could lead you in the wrong direction. Par exemple, si tu dis un coup de soleil, ceci se traduit en anglais comme a hit from the sun, but the proper translation would be a sunburn. And it goes the other way too. In English we would say heartburn, and that would translate to brûlure de cœur, mais en réalité le terme se traduit comme brûlure d'estomac. Here we have some examples of when medical terminology is translated word for word or incorrectly in Grey's Anatomy and L'Anatomie de Grey, and we will provide the proper translation and an explanation.
So thank you, Christen. So as my partner stated, it is very important to be accommodating to as large as a demographic as possible when it comes to medicine. Personally, I work at the clinic located in Walden, Ontario, where I see patients that speak English as well as French. Many of them appreciate the fact that they can receive healthcare and diagnosis in their first language because it helps them better understand properly, and it also eliminates that language barrier between the doctor and the patient. So healthcare professionals also appreciate this as well because English may not necessarily be their first language. If you're speaking to a colleague in your second language, it is very important to know the exact terminology to avoid mistakes or misdiagnosis. So I have 2 Grey's Anatomy clips from season 1, their first episode, and this will show you guys how sometimes, especially in medicine, medical terminology terms aren't necessarily a direct translation. So here is the first clip.
What do we got?
Katie Bryce, 15-year-old female, new onset seizures, intermittent for the past week. IV lost en route, started grand mal seizing as we descended.
Qu'est-ce qu'on a?
Cathy Bryce, 15 ans, nouvelle crise de convulsion, intermittente depuis une semaine. A perdu sa perf en route, a commencé une crise d'épilepsie à la descente.
D'accord, on la met sur le côté.
So here we are evaluating one passage, which is said by the paramedic when he says new onset seizures and started grand mal seizing as we descended. In French, he said nouvelle crise de convulsion, commencé une attaque, crise d'épilepsie. So it is easy to think that this is a pretty accurate translation, and it's not completely wrong. However, there is one mistake, and that is when he stated crise d'épilepsie. Donc, il est important de noter que le terme crise d'épilepsie n'est pas un terme complètement incorrect. Par contre, le terme propre utilisé dans ce scénario est commencer une attaque grand mal ou bien commencer une crise tonico-clonique. Donc, une crise d'épilepsie se traduit plutôt comme epileptic seizure ou aussi epileptic fit. So in other words, the term used here was not completely wrong, however, not completely correct. So crise d'épilepsie translates directly to epileptic seizure or epileptic fit. So now we will be viewing a second clip, and this will be looking at more the different terminologies used for specific medical tests.
Let's go.
Well,
We got no wet fish on dry land.
Absolutely, Dr. Burke.
Dr. Bailey, let's shotgun.
That means every test in the book, CT, CBC, Chem 7, tox screen. Christina, you're on labs. George, patient workups. Meredith, get Katie for a CT. She's your responsibility now.
Wait, what about me?
Honey, you get to do rectal exams.
Now here is the same clip, but in French.
Il paraît qu'on a une crise d'épilepsie.
C'est exact, Dr. Burke.
Docteur Bailey, le grand jeu.
Ça veut dire tous les examens. Scan crâne, NFS, chimie, iono, recherche de toxiques. Christina, tu te charges du labo. Georges, tu fais le diagnostic. Meredith, conduis Cathy au scan. Elle est sous ta responsabilité maintenant. Et moi, je fais quoi? Toi? Tu vas te charger des touchés rectaux, ma belle.
So here we have Dr. Bailey asking the interns to perform a series of tests. So we have the CT scan, the CBC, the Chem 7, the tox screen, and the patient workup. In French, they said scantrain, NFS, chimio-iono, recherche de tox, et buffet diagnostic. So in this case, we actually have 4 out of 5 that are incorrect. CT would directly translate to test tomodensitométrie. Chem 7 would be either test iono ou test sanguin ou chimie 7. Tox screen would be a dépistage de drogue, and a patient workup would be a bilan du patient. Now this is very important because, as stated above, if another healthcare professional is told the improper French terminology, this could cause some confusion among peers, especially with newer staff. Whether you're a trainee, a GP, a nursing student, a social care worker, or a doctor's receptionist, if you work in this environment where basic comprehension of medical terms are very important, it is very important that you understand the proper terminology and use the right ones. So in any of these roles, you may find yourself responding to like an emergency situation, making a 911 call possibly, and having to administer life-saving care like CPR or first aid. When you are dealing with these emergency situations, you have to be able to properly communicate with the people around you. So the language helps medical staff communicate more efficiently, makes documentation easier. It also ensures that they don't have to explain complex medical conditions or diagnosis to their peers. So it helps make everything go a lot smoother and quicker. So another purpose of the proper use of medical terminology is that it can help make poor communication and poor documentation less frequent. So this ensures that staff can quickly and accurately give proper health care and just makes everything run smoother. Thank you.
Monsieur Labelle?
Oui, c'est moi.
Hello, my name is Anthony. I'm a first-year medical student at the Northern Ontario School of Medicine. What brings you in today?
Anthony, est-ce que tu parles français?
Un peu.
Oh, ok. J'ai mal au cœur.
Okay, your heart, eh? Maybe I'll have a listen to it. Do you mind just laying down on the bed?
Okay.
Here, I'll help you up. Monsieur Labelle, I think we'll just run some tests right now, okay?
Okay.
Hey, Dr. Dan. Hi. So I just saw Monsieur Labelle in room 203. He said he was having some heart pain. So I was thinking about maybe running CBC, trope, and getting an ECG for him. What do you think about that?
Yeah, that sounds good.
Okay, great. He said it was his heart, but I just don't see anything wrong with his heart.
Anthony, how's it looking?
Oh, hey, Dr. Dan. So I'm just looking at Monsieur Labelle's lab work, his chest x-ray, and his ECG here. I just don't see anything wrong with his heart. Yeah, so I'm kind of stumbled what's going on with him, but he really seemed like he was in a lot of pain, and he even told me that his heart was really hurting him.
Okay. Well, let's go take a look.
Okay. Yeah, I think that'd be great. Okay.
Well, bonjour, Monsieur Labelle.
Oui, bonjour.
Hi, my name is Dr. Dan. My student Anthony Miller was telling me that you're having heart problems.
Dr. Dan, est-ce que tu parles français?
Ah oui, certainement.
Ah, ok, merci. Ouais, j'ai vraiment mal au cœur.
Oh, t'as mal au cœur, donc c'est plus un sentiment de nausée.
Oui, ça serait ça, oui. Merci.
Ah, ok. Hi, Anthony. So I spoke to Monsieur Labelle, and he was telling me that he's actually having problems like with nausea in his stomach. So in French, there's this expression called j'ai mal au cœur, and it's more of like a feeling of unwellness in the stomach, kind of thing, which is an honest mistake.
Okay. Yeah, I just I didn't want to seem incompetent, and I really just wanted to try out my French skills, and I think I recognized that word "car," and I knew that meant heart. Well, I guess I thought it meant heart, and I guess I just kind of went with it without clarifying with anyone. And yeah,
that's no problem at all. The patient did say that he really appreciated you trying to speak French, but in the future there are a whole variety of resources, such as we have some staff that speak French, interpreters. There's a phone number that we could always call. So there's an abundance of services that could help you in future situations. But the patient definitely appreciated you trying to make him feel comfortable.
Well, thanks, Dr. Dan. I think I'll definitely look into some of those services that you recommended, and I mean, I guess there's no reason why I can't continue to work on my French skills and try to get better. This is definitely a good example of why I should keep working on my French skills.
Oui, donc comme Dr. Dan l'a expliqué dans la situation, j'avais vraiment des problèmes de nausée, pas nécessairement des problèmes de cœur, mais en français, j'ai mal au cœur. Les francophones vont savoir que c'est une expression qui veut dire plus le côté nausée que le côté du cœur. So, like Dr. Dan explained, I was presenting with nausea and not necessarily heart pain, which is what a French expression that would directly translate to heart pain. But again, Francophones will use that expression a lot, and you will hear that in a clinical setting. So it's important to be aware of those expressions, as well as what are your resources so you can help your patients in the future.